This is the Module 3 project for UMass Boston's Vision Studies program, Implications of Low Vision, Spring 2013. This is Robin Sitton. I'll be walking you through a functional vision assessment or FVA kit for use with adults with adventitious vision loss due to disease or injury. As we go through the items in the kit, I'll present and discuss each of the groups of items that can be used for a variety of assessment activities. The items in the kit are intentionally low-cost, common household items that pack and travel easily. Items similar to the ones I've included can be substituted, and items tend to be added over time. Each time you work with a new client or a new setting, you're bound to discover new activities which can be added to the kit without taking up a lot of space. Now, as mentioned, my kit is suitable for adults between the ages of 20 and 70. Perhaps skewing toward the younger end of that range. What the prospective clients have in common is a desire for continued independence. Perhaps they are still actively employed or would like to be employed. Because of my professional interest in veteran services, I've also taken into consideration that the client may be a family breadwinner and have responsibility for others, such as children or parents. The client may have cerebral vision impairments, particularly traumatic brain injury, or TBI, which presents visual difficulties. I'll mention these as we go along. To quote Dutton, this kind of injury carries common complaints like traumatic visual acuity loss, binocular dysfunction, presented as convergence insufficiency or strabismus, leading to diplopia, headaches, blurred vision, visual field defects. Other problems may include visual perceptual and cognitive deficits. Persons with visual perceptual disorders may have difficulties moving accurately through visual space, difficulties handling complex visual scenes, problems recognizing certain aspects of the world around them, or they may be troubled by seeing visual phenomena that they know not to be present. Individuals may have additional medical considerations, including mental illness or depression. And a given individual may or may not be in active rehabilitation therapy for those conditions. In other words, like many of the medically complex pediatric clients we have discussed in this program, low vision may be considered a, quote, minor condition by the individual, who does not realize the types of adaptations that could increase functional vision. This is an old laptop bag. Laptops used to be a lot bigger. I've always liked this bag because it has a lot of compartments and pockets. The sides zip all the way down, which I'll demonstrate shortly, and it is soft enough to expand to fit the materials inside and still remain fairly lightweight. It has a shoulder strap as well as the handle you see here, so it's quite easy to move from place to place, and it doesn't need to be fully unpacked to get out a few items. I should say I make that a little easier with internal plastic bags for most materials, which you will also see shortly. The key is simply not to pack more than you can carry, and to find multiple uses for the items you do carry. I confess I learned this from my corporate experience, traveling to client sites where you could never assume that they would have the simplest office supply, and you need to carry a lot on your person. Here's the bag fully unpacked. We'll look at each of these items as we go through the presentation. You can see the individual plastic bag groups here. I reuse a lot of large plastic bags when I come across them. Tortillas come in nice large packages, so do coffee filters. They zip closed, and if you pack them right, can fold over on themselves pretty easily. You can also use freezer bags. Of course, they usually have labels and are durable plastic. Try color coding if that helps you as well. The idea is that you want to be able to find what you're looking for easily, and you want to be able to repack as quickly and tidily as you unpack. Particularly when you're in the client's home, you want to show respect for their space by keeping your own clutter to a minimum. We'll explore the kit within the context of the assessment itself, which begins with an interview and conceivably a medical history or clinical review, which have been done ahead of time to prepare for this meeting. There's plenty of space in this type of bag for file folders to lie flat in a zipper pocket. this being a laptop bag file space is actually provided. These are standard size folders. Assume one or two of them contain the reports from other team members. Another may be your own client record, an assessment plan. You may also wish to keep printed acuity tests that you reuse in folders like these. I have mine in a different section, but I'm able to fit 5 to 10 files depending on their thickness in the file pocket of the kit. One useful resource to keep packed is a prescription drug reference. This is a simulated volume, but it is the accurate size of this particular pocket guide to commonly prescribed drugs. Many medications carry visual side effects, including dry and itchy eyes, photosensitivity, headache, and the like. Dizziness or vertigo, which also can be pharmacological in nature and not an organic condition. With a combat or blast injury such as TBI, a patient is likely also being treated for post-traumatic stress or depression, which could signal to the assessor one or more prescription drugs are probably in use. Of course, knowing your client's medications can have implications for the assessment and for therapeutic work as well, as it can determine the best time of day for your work, the order of activities, and the client's stamina. It's a good reference to have. Standard clinical charts for acuity are easy to come by and they travel well. They can be useful for comparing the client's medical history, but are not as crucial as real-life observations for FVA purposes. I've packed the HOTV in my kit. More importantly, observe the individual's distance acuity where they are. If possible, work in both natural and artificial lighting, which can present different results. For distance assessments, a tape measure is your best tool here. The fabric kind, used by seamstresses, fit anywhere, including your pocket. We'll see this resource in a later slide. Occluders can be had for under $10, but these wide craft sticks, also known as tongue depressors, will also work. Again, the goal is easy to carry and easy to sterilize, if not dispose, after use. Traumatic brain injury often results in double vision or strabismus that may not interfere with clinical acuity results, but be a burden to daily function. There are several components of near acuity to observe in functional use, the most obvious of which is reading ability. I made a few cards of different print sizes by printing text onto sticker sheets. They're slightly opaque to reduce glare, and they're stuck onto file folders to keep them sturdy. Because we're not working with children, they don't have to be board durable and can be easily refreshed from a saved document when needed. You see an Amsler grid there as well. We'll discuss visual field shortly. The grid is displayed with this group because it's filed with other papers and cards in the kit. Keep your client's education level and reading ability in mind when selecting texts. To get an observation of functional vision and not literacy, the material needs to be appropriate. Asking the client to read items in their daily routine is also helpful. You'll likely see their true posture, distance, and eye preference when they handle the things they handle in their daily lives: the mail, the remote, a magazine. I have 2 ordinary pill bottles in my kit. The idea is not to see whether they can read the absurdly small print none of us can read, but to observe how they handle the bottle to do so. What strategies are they already using? Do they work? Also pictured here is a little fan booklet of common household repair and safety tips. I like it because it already has different size prints, it folds up easily, and contains practical life skill information. The booklet is actually a chapbook of poetry written in large print. Again, an item with a lot of potential use that carries no size or weight in the bag. Contrast sensitivity is often affected by brain injury. Clinical tests like contrast patches, the LCVA test, or even something like the Hiding Heidi used with children can be put on cardstock along with the near acuity test. Items I've included in my kit for contrast assessment have additional uses. Multicolored patterns and colors of paper are good backgrounds for activities and can be found at stationery or art stores by the pack. You only need a few pieces of variety in your kit at a time. and can plan your needs, patterns, colors, light, dark, ahead of time. Also shown here are colored index cards. They're lined on one side and they're blank on the other. These cards, along with different weights and colors of writing instruments and highlighters, can be used to experiment with adaptations. They can be used to observe the client's writing needs. They can also be used for distance acuity assessment. The lined pad at top, for example, are post-it notes. We can write on them with different markers and pens, stick them right on the wall at a distance, and determine the best size and contrast for this individual. Pack a few of each kind and keep them the full pack at your home base. Replenish as needed. These small items like pins and post-its can be bagged together within the kit. Visual field is particularly vulnerable following brain injury. The VA estimates 60% of TBI casualties will have a field deviation in one or both eyes. The scotomas are the result of nerve damage. Of the items we've already reviewed, markers and pins are fine fixation objects for adults. They're large enough to fix and follow and don't need to be particularly entertaining as they do for children. You'll see some other items in a minute that can also double as fixation objects if needed. In the lower left, right here, is the visual field testing wand I made for our early lab activity. It's just a playing card on a wire hanger. My preferred tool here would be something along the lines of a cat toy, the kind that's a fishing rod type wand with a fixation object attached. The wire hanger does pack well, though, and it's durable for what it needs to do. The baseball is actually a sponge material stress ball type, which can be used in a confrontation test as an object introduced into the field, and to observe depth perception and reaction time. Binocular dysfunction is fairly typical in TBI patients. I love card decks because you get 50 of something in a tiny little package. What you see here are two playing card decks, one large size and one mini. You could add the large print card decks as well, braille cards if they are of interest. Souvenir card decks like famous authors, paintings from the Louvre, etc. can be used for all kinds of purposes, from simple recognition to observing response to visual clutter to discriminating details. They take up very little space. For some segments of the population, cards are a real source of social activity. Some of this is generational. Some of it is regional. Some of it is cultural. People may not list cards and games as vision goals, but really regret losing this part of their social life. Note these letter cards pictured here. These are from a board game called Probe by Parker Brothers. A single game has about 100 of these cards. The letters are about 8M, and being able to separate letters from a visual chart can open up the creativity of your viewing tasks. Speaking of board games, I rated all of mine. I found a treasure trove. Different sizes of colors and dice, tokens and chips. We'll go through these clockwise, starting at 12. These right here are chips from Parcheesi. They're about the size of a dime, and you can see their thickness. These chips are actually wooden, but everything else you see here is plastic and washable. I haven't thought of a use for these translucent yellow chips yet, but I like the feel of them, and their amber tone may actually have a use in glare or contrast tasks. The letter dice are from Boggle. I used them in my acuity lab test, and we had a lot of fun with them. Next are standard game tokens and 3 colors of dice. With children, you wouldn't likely use items this small, but they're good for adults in observing their hand-eye coordination and close-up work with small objects. And again, it can be encouraging for some people to find strategies for the simple things that give them pleasure, like playing games with children or being able to participate in group activities. I've learned in my reading about traumatic brain injury that a pattern of tracking and convergence difficulty is emerging. It can be difficult to pin down the source of a sudden change in an individual's ability to track a line of text. Nerve damage affecting saccadic movement vestibular dysfunction, giving the feeling patients describe as motion sickness, nystagmus or muscular tics causing fatigue, or simply an inability to sit still and focus attention, complicated by post-traumatic stress. There is an adult version of the DEM, the Developmental Eye Movement Test. It's admittedly a clinical test, but one that I added to the kit. In this exercise, the participant reads down a column of numbers on the left, then down a column on the right, and is scored for a baseline. This is repeated with a second set of numbers and scored. And finally, the participant reads across 10 columns from left to right, and the assessor notes omitted, added, and transposed numbers. I might plan this exercise for a specific client. I wouldn't include it as a standard in my kit. It's not a functional assessment, but it could be enlightening if saccadic movements are inefficient or fatiguing. I was also interested to read about tests involving these find the difference between two photos or illustrations, such as picture games found in newspapers and magazines. I found several online sources for picture games like these that could be printed out. There's a lot of free apps, but they're mostly geared toward children. I would recommend purchasing one of these collections from Brain Games and maybe have some pages removed and mounted. A few other tools to make sure you pack and keep packed. All of these lighting devices are bagged together. Certainly more could be added. On the upper left is an LED reading light, the kind that fits on a book. And across from that, also shown here illuminated, is a headband-style lamp with 3 small white lights. This is good for hands-free needs, such as testing a visual field or holding a fixation object and needing to observe reflexes, or simply to see in a dimly lit environment. This lamp also happens to have a red light setting, which might prove useful. Pin light is here between them, next to a cloth tape measure. Most fabric store tape measures like this are about 2 yards, which are easily managed, and it rolls up to about the size of a quarter. Also pictured right here is a digital recording device, which I happen to have from description work. That it's a good tool for those who need to record notes quickly as they move to their next client. Bag your office supplies together and never underestimate what you might need. In fact, fill whatever space is left with extra writing tools, a small notebook, clips, tacks, double-sided tape never runs out of jobs. Smaller scissors than those pictured here would be recommended. In fact, I would recommend a portable desk kit that stashes right inside your larger bag. So let's pack it up. You see all the individual bags, and as you saw throughout the presentation, they just fold up here, so each thing is grouped together with things that are like it, so they're very easy to grab and pull out. Office supplies and pins on the outside pouch where they're easy to get to without having to open the whole bag, and files in the file pouch on the opposite side. Thanks for having a look. A little creativity and not a lot of legwork, and I was able to get the foundation of an FVA kit that I look forward to building over the years.